xương phản hồi là một cái kỹ thuật thứ nhất, và người ta hy vọng là sẽ có nhiều nghiên cứu ở nhiều các trung tâm ở Đà Nẵng để mà có một cái kết luận về cái vấn đề như là cái độ tuổi vào cái vi phạm hay không, và hy vọng những cập nhật GMAS của ASEAN những năm tiếp theo đây thì người ta có thể đưa vào một cái quỹ về độ tuổi của mô. Bởi vì có những cái còn như thế thì người ta tìm vào cái nội dung tài chính của công nhân là xin nói về cái xương cả của mô là cái thế nào để mà hỗ trợ trong cái phản khi phát mà có thì sử dụng cái còn thể lợi. Về thứ hai là cơ sở của cái vấn đề này, cái kỹ thuật này rất nhiều vào cái hai cái kỹ thuật chính đó là cái bước chỉ là khi chúng ta dùng cái vấn đề vào cái mô thì khi để cái mô chỉ là và thứ hai khi để cái thể thì những cái mô cái sóng bị dài trong mô đây là hai kỹ thuật chính. Cái kỹ thuật chính là kỹ thuật chỉ xương nhiều cái mức bị dài nhưng mà các nơi thì là xương và hồ scan scan imaging. Và cái kỹ thuật này cả nước là nó có những cái máy tầm trung, tức là người ta ghi nhận xương trước khi làm những cái ép đồ giò, sau đó người ta ghi nhận phía một cái thứ hai là ép đồ giò như vậy hai cái có hai cái hình người ta ghi nhận cái siêu âm và người ta sử dụng sử dụng những cái hình ảnh như cái mức bị giảm những cái mô cái bị giảm mô nhẹ bị giảm như là có hai cái mô mà trên siêu âm cái mô không có thể tạo được rõ nhưng mà trên siêu âm là một người nhận dạng nó rất là rõ về hình ảnh của sự diễn đạt còn cái mô về hình ảnh của sự phản hồi của sọ tâm như là hai cái hình ảnh nó để có hai cái công ty khả năng với cả công ty là công ty về nghề trong cái sơ phản hồi của phòng thì cũng là cái cuộc là sóng bị giảm thì sóng bị giảm thì do không có trên cái mô phá xạ mà chúng ta đặt do như trên cái bề mặt da trên cái
Alo, tức là dịch ngược lại cả tiếng Anh nữa. Tưởng là ok. For elastography, the wave is the transverse wave. But when the wave attacks the tissue, it will vibrate the tissue and create the transverse wave. So we can measure the change in the transverse wave and calculate the elastography value. We can have another way to see the change. This is the strain elastography. We put the probe perpendicular to the skin and apply slight pressure, about 10%. In some ultrasound scanner, we can see some the color scale defining the signal on the left side, and the other one is the stiffness degree. We can code it as red or blue. In this case, we can see the red is hard and blue is soft. And we see on the left side is the 2D ultrasound, and the other side is the elastography map. According to the World Associations of Ultrasound, we can see the distortion level can be measured when we have the region of interest is large. In this case, we can see we can compare the size of the thyroid nodules in both the map 2D and also the elastography map, because we can also define this the partial stiffness or the whole nodule is hard. And also we can measure the ratio between after nodule between the elastomap and 2D map. In the case too many nodules in the thyroid, we can measure the elastography in comparison with the adjacent tissue structure. We have another way. So in this case, we don't need to use the hand to compress, but the ultrasound machine can create the wave, and then it vibrate the tissue, and then we can measure the elastography value. In 2D, and the other way is the elastography. You can see the scale. The blue, we can have the kilopascal or meter per second. We can apply a region of interest to wherever you want to measure. In a recent research, I measured the wave in the normal values about almost 2 meters per second. This is the normal findings. No difference between male and female. This is the reference for the normal elastography's wave, shear wave. So we can based on some parameter. The first one is the size, the size of the nodules in both map. If the size on elasto map bigger than on 2D, so we can suspect of cancer. So we can measure as the diameter or area. So if the area measures on the elastography map bigger than in the 2D map, so we can think this patient, this lesion is malignant. According to another research, if the ANA more than 1, so we have a specificity of cancer is about 92%, and the specificity is about 46%. The second parameter is the pattern. According to Scuba, we have a 5 level from A to E. So level 1, this is homogeneously. Level B, so a few hard spot in the lesion, and the third one is a large part in the center. The fourth one is almost that the nodules are hard, and the level 5 when we have infiltration around the lesions. According to Asteria, we have only 4 levels, so they combine between 4 and 5 from Ragu. According to Ragu's map, so from level 4 to 5 is highly suspicious of cancer with the specificity of 100%. In this case, this is in our clinic. On B, there are 2 maps, so elastography map on the right and the B mode on the left. And we see almost the same size, but on the other image on the right, we can see the elastography map, the lesion is bigger than on the B mode. So here is the shear weight. We can compare the shear weight between the nodules and the adjacent tissues. So we can compare the ratio between the nodules and also the normal tissues. So when we compare the A and B absolute value, if we have the shear weight ratio more than 2, so it's more high and more likely to be a cancer. With the sensitivity is about, and also if the SR, the larger SR, the more sensitivity. You can see here the shear weight ratio is about 1. And we can see in the image on the right, it's very low ecogenicity, very small, but the AR is very high. In some other scanner like Samsung, we can have another value which is named ECI. So we can measure the absolute value between the nodule and the tissue adjacent to the carotid artery. So if the value is more than 3.5, it is highly suspicious of cancer. So for strain elastography, we base on 3 parameters: the size, elasticity, and echography. And also we have a scale from 1 to 5. For strain elastography, we can have a cutoff between 2 to 4. If we base on the ECI value, comparing the shear weight between the normal tissues and nodule, if more than 3.5, the lesion is more likely to be a cancer. We can apply the absolute value of the shear weight according to some research from Belgium with 158 nodule, 21 benign, and almost of them are benign. We can see for patients with malignant, the value is more than 2.6. For Japanese research, they measure the stiffness on the specimen from after surgery, so we can see the cut-off size more about from 2.5 to 2.6. Generally, between study, we can see the cut-off value is about 2.5 meters per second shear wave speed. For some Asian study, the value is about 2.8 with the highly specificity and sensitivity. According to the World Association of Ultrasound 2007, so we can measure the shear weight velocities in different regions of interest, have a very good sensitivity and also specificity. So we can apply sonoelastography in the diffuse thyroid disease, like Hashimoto's thyroiditis. So the shear wave velocity is much higher than in the normal tissue, significantly different. In another study, we can see the shear wave velocities in Hashimoto's thyroiditis and grave is much higher than in the normal tissues. So the W fund suggested that we can use elastography to differentiate and also to measure the different pathologies of thyroid. So in conclusion, we can see elastography can help to measure the lesion. However, using strain elastography with the hand compression may affect the results because it's very subjective. Easy to get the artifact due to breath, swallow, and also the carotid pulse. However, they have some advantage because it's quite common in some scanner, and it's not very difficult to do training. So with the shear wave elastography is much easier and you reduce the artifact. However, the depth of the image is not too high. It must be less than 5.5 centimeter. And also the region of interest is quite large. Sometimes it's hard to measure the small nodules. However, you have some advantage. That we can apply when we do the thyroid ultrasound. We can choose the hardest place to do FNA. For the correlation between the shear wave velocity and the cancer risk, so we can see that it's very hard for some nodule with calcification and also the cystic nodules. It may create the false positive. In some cancer, for example, the follicular carcinoma is not very hard, so it's soft. Sometimes it can cause the false negative. However, the World Association of Ultrasound suggests that shear wave elastography is very hard, some inhomogeneous nodule. So in summary, elastography can apply to measure the thyroid nodules, and also shear waves and strain elastography can have some category in classifications of risk cancer in thyroid nodule, and also the sonography can provide additional criteria for to classifications of the thyroid nodule. Thank you very much.